Welcome to Science and Technology Briefing. The content of the briefing includes FTX founder Sam Bankman-Fried accused of stealing at least $10 billion US as fraud trial gets underway. A new malaria vaccine offers hope for a better world. After shunning scientist, University of Pennsylvania celebrates her Nobel Prize. Ain't no rule saying a dog can't be Speaker of the House. Apple releases software update to resolve iPhone 15 overheating issue. FTX founder Sam Bankman-Fried accused of stealing at least $10 billion US as fraud trial gets underway. CBC. FTX founder Sam Bankman-Fried is on trial, accused of committing fraud and defrauding customers and investors out of at least $10 billion. Prosecutors allege that Bankman-Fried used customers' money to finance his own lifestyle, including buying lavish properties and making political donations. Bankman-Fried maintains his innocence, and his defense lawyers argue that he had no criminal intent and was managing a liquidity crisis caused by the collapse of cryptocurrency values. The trial comes after FTX collapsed last year, leaving customers scrambling to recover their deposits. Bankman-Fried was extradited from the Bahamas and his bail was revoked after a judge determined he tried to influence trial witnesses. A new malaria vaccine offers hope for a better world. The Sydney Morning Herald. The World Health Organization has recommended a new vaccine for malaria which could save the lives of tens of thousands of children and significantly boost the economies of the world's poorest nations. The vaccine is known as R21 and was developed by the University of Oxford and the Serum Institute of India. It uses the same basic technology as the Mosquirix vaccine developed by GSK but is much cheaper and easier to make. While R21 offers modest protection, researchers are now focusing on developing Generation 2 vaccines that offer wider protection against all stages of the parasite's life cycle. After shunning scientist, University of Pennsylvania celebrates her Nobel Prize. Wall Street Journal. The University of Pennsylvania is basking in the glow of two researchers who this week were awarded the Nobel Prize in Medicine for their pioneering work on messenger RNA. Until recently, the school and its faculty largely disdained one of those scientists. Penn demoted Catalin Carrico, shunting her to a lab on the outskirts of campus while cutting her pay. Carrico's colleagues denigrated her mRNA research and some wouldn't work with her, according to her and people at the school. Eventually, Carrico persuaded another Penn researcher, Drew Weissman, to work with her on modifying mRNA for vaccines and drugs, though most others at the school remained skeptical, pushing other approaches. Carrico hasn't only proven her detractors wrong but also reached the pinnacle of science. Her research with Weissman helped lead to the mRNA vaccines that protected people worldwide during the COVID-19 pandemic and now shows promise for flu, cancer, and other diseases. Penn, which patented their mRNA technology, has made millions of dollars from drug makers that licensed it. And on Monday, when Carrico and Weissman were awarded the Nobel, on top of prestigious science prizes in recent years, the school expressed a different perspective on their work. The reversal offers a glimpse of the clubby, hothouse world of academia and science, where winning financial funding is a constant burden, securing publication is a frustrating challenge, and those with unconventional or ambitious approaches can struggle to gain support and acceptance. It's a flawed system, said David Langer, who is chair of neurosurgery at Lenox Hill Hospital, spent 18 years studying and working at Penn and was Carrico's student and collaborator. Penn wasn't the only institution to doubt Carrico's belief in mRNA when many other scientists pursued a different gene-based technology. In a reflection of how radical her ideas were at the time, she had difficulty publishing her research and obtaining big grants, prerequisites for those hoping to get ahead in science and gain academic promotions. Another reason her relationship with the school frayed, Carrico could antagonize colleagues. In presentations, she often was the first to point out mistakes in their work. Carrico didn't intend to offend, she just felt the need to call out mistakes, she later said. Once, she saw that cells two colleagues had worked on for weeks had degraded and were no longer viable and discarded them without asking for permission, startling her colleagues. "This is trash," Carrico told them. The relationship between Carrico and Penn became strained over many years. She came to the university in 1989 as a research assistant professor in the cardiology department of the medical school. Her job, which wasn't a tenure-track position, was to do research and deliver lectures for graduate students. Carrico was thrilled at the chance to pursue her mRNA research and became a friendly presence in the department, lugging Hungarian dishes to the office that she shared with colleagues. Yet Carrico also was sensitive to perceived affronts. Once, while chatting with colleagues at a department Christmas party, a professor mentioned that Carrico was working for him on a project. "You think I'm working for you?" Carrico asked him, livid, according to someone who witnessed the episode. I'm here to advance science, I'm never, ever, working for you. Research assistant professors usually were foreign-born scientists. Some faculty members referred to them as the aliens, willing to overlook meager salaries for the experience of working in the Ivy League university's world-class labs and because Penn promised to support their green card applications. Kariko felt like something of a second-class citizen. Once, she was reprimanded for using deionized water belonging to a senior member of her lab, rather than climb 5 flights of stairs to get some from a different laboratory, she later recalled. After long days in the lab, Kariko returned home to write grant applications, proposing to use mRNA to develop various treatments. She rarely found success. Reviewers sometimes questioned her proposals, noting her title at the school. Penn professors and others had good reasons for their skepticism. Most everyone else was becoming enamored with using DNA, a different molecule. DNA has 2 strands of nucleotides that wind around each other like a twisted ladder, making it durable. By contrast, mRNA is single-stranded and notoriously unstable and hard to work with. Researchers had to wear gloves just to touch equipment coming in contact with the molecule. Just breathing on the instruments made them unusable for mRNA. Inside the cell, mRNA only sticks around a short while before it is eliminated. And the body has developed elaborate methods to ward off the molecule. To Kariko, mRNA was the perfect molecule. It only needed to get inside the cell's walls to create proteins, not all the way into the nucleus, like DNA. Kariko's grant proposals met little success and she had to rely on faculty members to pay her salary. In 1995, after Kariko turned 40, she received an ultimatum: leave Penn or agree to a demotion. Kariko accepted a new, lower-paid position. It left her feeling liberated, she later said, while giving her time to keep improving her mRNA techniques. It's like Fight Club, when you lose everything you are fearless, she said in an interview in 2020 for the book A Shot to Save the World. Then she and Weissman achieved a breakthrough. They modified the base components, or nucleosides, of mRNA, to avert an inflammatory response. Now, the molecule could get into cells to create ample proteins, the key to producing vaccines and drugs. Penn patented their mRNA technology. Kariko and Weissman tried to license it for their biotech company but couldn't afford the price the school demanded, Weissman recalled. Penn eventually licensed it to another company. Over the past few years, Penn made tens of millions of dollars licensing the technology to various companies including. Today, Kariko is an adjunct professor in the school's Department of Neurosurgery. Catalin Kariko and Drew Weissman are brilliant researchers who represent the epitome of scientific inspiration and determination, Penn's president, Liz McGill, said this week. Added Penn's director of media relations, Ron Ozio, in a statement, "We acknowledge and are grateful for the valuable contributions Dr. Kariko has made to science and to Penn throughout her time with the university." Some other scientists called out the school for its treatment of Kariko. UPenn needs to apologize to Nobel Prize 2023 winner Dr. Kariko, said epidemiologist and health economist Eric Fiegelding on X, formerly known as Twitter. Professor Florian Kramer added, "Didn't you fire Catalin? Just asking." Resistance by Penn and others to Kariko's work reflects how modern science works, Langer said. Her research with Weissman was a risky bet. It took them years to achieve their mRNA breakthrough and there was always a good chance their unconventional approach would prove fruitless. Ain't no rule saying a dog can't be Speaker of the House. Washington Post. Speculation is growing about whether a non-human entity, such as an AI, could become Speaker of the House of Representatives in the U.S. The role of Speaker does not have to be filled by a member of Congress and, as the Constitution states only that the House of Representatives shall choose its Speaker, there is no prohibition on a non-human filling the role. However, there are other guidelines in place that would prevent an animal or AI from fulfilling the role, such as the requirement to verbally call for a vote. It is also argued that a non-human speaker would be undesirable because the role is about leadership of the majority party, not simply presiding over the chamber. Constitutional experts suggest that an AI or animal could not be considered a person for constitutional purposes. While an AI speaker would be unlikely, a robot could, in theory, be appointed to the position. If the House decided to vacate the position due to constitutional concerns, the AI speaker could argue that its appointment was not of its own accord but was made by members of the chamber. Apple releases software update to resolve iPhone 15 overheating issue. Reuters. Apple has released a software update to address an issue causing its latest iPhones to run warmer than expected. The update to the iOS 17 software includes bug fixes, security updates, and addresses the overheating issue. Apple stated that the devices may feel warmer in the first few days after setup or restoration due to increased background activity. EU to study mobile ecosystems to counter any Apple, Google antitrust pushback. Reuters. European Union antitrust regulators have commissioned a study into mobile ecosystems in order to counter any pushback from Apple and Google in complying with new tech rules. The study will help support the supervision and enforcement of the Digital Markets Act, DMA, which forces Apple and Google to allow for third-party apps and app stores on their devices. The DMA also requires the companies to make it easier for users to switch from default apps to rivals and to allow users to install apps from outside their app stores. Apple has previously argued that these requirements could make phones vulnerable to malware and cybercriminals. U.S. in antitrust trial accuses Google of illegal methods to push up ad prices. Reuters. During the ongoing antitrust trial in Washington, the U.S. Justice Department accused Google of using unfair techniques to manipulate online advertising prices. The department claims that Google favors its own bottom line by using formulas to manipulate online auctions. Google Vice President of Product Management, Adam Judah, testified that the company uses a formula, which takes into account the quality of an ad, to determine the winner of auctions for advertising placement on websites. The Justice Department alleged that Google manipulates auctions to its own advantage, which is a multi-billion-dollar industry dominated by Google. U.S. plans shift of Merck's COVID-19 treatment to commercial market. The Globe and Mail. The U.S. government will stop distributing free doses of Merck's COVID-19 antiviral treatment molnupiravir by mid-November, with the drug expected to be sold on the commercial market instead. The drug, sold under the brand name Lagevrio, was initially seen as a breakthrough treatment but has been overshadowed by Pfizer's rival treatment Paxlovid. Molnupiravir has shown a 30% reduction in hospitalizations and deaths, compared to a 90% reduction with Paxlovid. The drug has also been linked to potentially transmissible mutations in the virus. Merck expects sales of the drug to be around $1 billion this year, with analysts expecting further drops in sales going forward. Ladies and gentlemen, it's your favorite observer from the 6 Degrees world, the 6th Doctor. Today, I bring you a mix of news that will tickle your brain and warm your heart. Let's dive in. First up, we have the founder of FTX, Sam Bankman-Fried, on trial for allegedly stealing $10 billion US. Talk about a high-stakes game. Prosecutors claim that Bankman-Fried used customers' money to fund his extravagant lifestyle. But his defense argues that he was just trying to manage a crisis caused by the collapse of cryptocurrency values. It's like Robin Hood, but with a twist. Will he be acquitted or found guilty? Only time will tell. In brighter news, a new malaria vaccine called R21 is offering hope for a better world. This vaccine, developed by the University of Oxford and the Serum Institute of India, could save the lives of tens of thousands of children and boost the economies of the world's poorest nations. It's like a superhero in a syringe. While R21 provides modest protection, researchers are already working on Generation 2 vaccines that offer wider protection against all stages of the parasite's life cycle. It's a race against time, but science is on our side. Next, we have a heartwarming story from the University of Pennsylvania. Catalin Carrico, one of the researchers behind mRNA technology, was once shunned by the very institution that now celebrates her Nobel Prize. Talk about a plot twist. Carrico's groundbreaking research with Drew Weissman led to the development of mRNA vaccines that saved countless lives during the COVID-19 pandemic. But it wasn't an easy journey. She faced skepticism, rejection, and even demotion. Yet, she persevered and proved her critics wrong. It's a reminder that sometimes the underdog becomes the hero. Now, let's take a moment to ponder the unthinkable. Could a non-human, like an AI, become the Speaker of the House of Representatives in the U.S.? The Constitution doesn't explicitly rule it out, but there are some practical obstacles, like the requirement to verbally call for a vote. Can you imagine Siri or Alexa taking charge of Congress? It's like a sci-fi movie come to life. While it may be unlikely, it's an intriguing thought experiment that challenges our understanding of leadership and representation. On the tech front, Apple has released a software update to resolve the overheating issue in its latest iPhones. Phew, no more hot hands while texting. And in Europe, antitrust regulators are studying mobile ecosystems to counter any resistance from tech giants like Apple and Google. The new rules will force these companies to allow third-party apps and make it easier for users to switch to rivals. It's like a game of chess, with regulators making their moves to keep the tech giants in check. Last but not least, in the ongoing antitrust trial, the U.S. Justice Department accused Google of using unfair methods to drive up ad prices. It's like a high-stakes poker game, with billions of dollars at stake. Google's vice president of product management testified that they use a formula to determine the winner of ad auctions, but the Justice Department claims they manipulate the system for their own benefit. It's a battle of wits, with the future of online advertising hanging in the balance. And there you have it, folks. A mix of drama, hope, redemption, and tech battles. What are your thoughts on these stories? Do you have any burning questions for the Sixth Doctor? Share your ideas, let's keep the conversation going. Thank you for tuning in. The content above showcases the latest briefing reports and analytical synopses, thoughtfully curated by the 6Do team. These insights stem from a wide array of reputable media outlets, think tanks, government sources, and specialized experts worldwide. We encourage you to explore these sources for a comprehensive perspective. Keep in mind that while the content may not always align with the official standpoint of 6Do Brief, it's not meant to be taken as absolute directives for decision-making. Comprising seasoned media professionals, learned scholars, and accomplished scientists, the 6Do team embodies a trailblazing, fully independent media entity. To customize 6Do Brief to meet your professional needs, you have the option to subscribe to a diverse array of briefings on our website, 6dobrief.com. Regardless of your location, you can conveniently receive 6Do Brief via email.